Hello and welcome to this episode of Dr. D TV. Today we're going to be talking about freshening your face, so let's get started. A lot of my clients want to know what's going to happen during the consultation. Well, here's how I want the story to go. I want you to think of yourself as a fabulous automobile. You are now a Jaguar. You can be a Cougar after we finish freshening the face, but let's just talk about Jaguars right now. And we're going to talk about those things that can really work on the paint job, but more importantly, take out a few little dents. So we want to essentially start with this, get a great restoration project done for you so you can look at this like this fine automobile up top. A significant number of my clients talk about, hey Dr. D, this just happened just a week ago. I woke up and this is what's going on, but I'm starting to see my mother and my grandmother. What can I do? And more importantly, what's going on? And this is essentially what's happening. Guys, we're supposed to be looking a little bit more distinguished, if you will, and I think that was us just feeding our lady's bull. What happens is the face goes from an upside down triangle to more of a square, where for us having a distinguished jawline looks a little bit, once again, more distinguished, much more handsome. But at some point in time, after losing the hair, gray hairs, then you go from distinguished and mature to looking a little bit old. And when this happens, of course, in the female face, we get more lowlights than highlights, causing those shadows or those distraction lines. And so what are the things that we can use in our rejuvenation toolbox? Well, at Fayetteville Plastic Surgery here, we have a lot of tools in the toolbox. There are plenty of folks out there that have just that one hammer and everything is a nail. So for that paint job, once again, let's control what we can control. And we're talking about sunblock. We're talking about minimizing exposure to smoking. We're talking about making sure we've got the hydration going. We're talking about fillers like Juvederm, Bellotero to fill in those lines instantaneously and, once again, accessorize what we're trying to put together. And then, of course, those wrinkle blockers like Xeomin and Botox, they're working on the upper third of the face while the fillers are working on those wrinkles of gravity in the lower part of the face, if you will. Hair restoration, very key. Although, being bald is a lifestyle, once again, if we're talking about those ladies who have lost their hair on their edges from traction alopecia, from tight braids, from chemical processing, or a female pattern baldness where that thin part in the hair is widened over time, if you will. And don't forget, whether you've got some outstanding ears, and I don't mean just great ears, if you will, or those that are deformed from congenital deformities, or even those that are acquired from sun damage, once again, putting a little fat in the earlobe so it does not look deflated or overly mature. Laser treatments are fantastic wash and wax jobs. What better way to even out smooth skin tone and texture with a fractionated CO2 laser treatment that takes care of sunspots and premature aging. Brow lift, eye lift, once again working on that upper third of the face. Mid-face rejuvenation to include fillers or giving back that cheekbone height really once again gives us that highlight that we're looking for. And don't forget lip rejuvenation by minimizing some of those vertical lines, smokers and non-smokers alike. Rhinoplasty, which once again takes away that hook or that ptotic or nose tip that's turning down. Cheek augmentation. Although implants are something that it can be used as well, we use more fillers and fat transfer at this institution. I think it gives a more natural look. Lower part of the face, nobody likes that turkey neck, not even at Christmas or Thanksgiving. But once again, the ability to wear that tie without a little bit of that skin hanging over is really, really crucial, especially for the male. And then, of course, today's seminar is all about the facelift, so let's go ahead and turn up, if you will. So what's happening during the face? And this is a great artist rendition of essentially what's happening in the face. So this is a much more rejuvenated face where we have the fat and all of those layers. And then essentially as we continue to mature, we lose a little bit of fat or that insulation. In my world, fat is good. But the other thing that we forget about is actually the bone. And once again, if we're losing bone and we're losing support, that skin and that muscle is redraping a little bit different than it was at 35 versus 55. So also what's happening is not only have we talked about losing the fat, but our muscles are getting weaker, they're getting thinner, and once again that skin, if you will, is not as holding elasticity as we've seen it in the past. Hence we get the distraction lines of the nasolabial folds, the puppet lines, if you will. And this is a great story that I like to tell people about the table and the tablecloth. So at 35 and at 25, we've got a great table, and that skin is your tablecloth that's really hanging very nicely. But as we lose some of that bone and support, or the table, if you will, all of a sudden that tablecloth is bunching up at the bottom there, and that's where we're getting the jowls and the excess skin. So once again, how do we build up that table to give you a nice redraping of the cloth? And so there are different things. Let's talk about some of those tools. Let's talk about the mini facelift. These are done usually in the office with or without a little sedation. Short recovery time. Maybe also adding a little bit of non-surgical treatments to include a fat transfer or a filler or a little bit of wrinkle blocker, which can give you a very, very nice look. The heavy neck, once again, there are two places that a woman cannot hide her age, her neck and her hands. So it's about creating more of that contour. For guys as well, even though we can put on a goatee or a beard, if we remove that shadow or keep that excess skin from falling over our tie, that is a fantastic thing for us. So which one are you? Are you jolly? Do you have the puppet lines? Are you saggy? Do you appear mad? Or you're tired? Are people saying that you're thinking really hard? Those are usually the comments that we'll get with folks. This is one of my favorites as far as injectables. So once again, whether you were using fillers for the nasolabial folds, the radius, the juvederms, the belloteros, or now our latest injectable, which is radio frequency, to tighten that skin, to give you that defined jawline, augmenting that with the fat transfers, if you will, to really give you a great look. And once again, no cutting. Quick downtime, get back to work really quick. And these are the places that we can use our injectables. The brow line to lift up the brow, the cheekbones, once again, the temporal line to minimize that wasting effect. We can also build a jawline. That's that line right there just below the lip, or even that orange peel look on the skin underneath the chin. All of those can be enhanced with a little bit of volume lift, if you will. This individual had a lot of fat loss here in the cheeks. A little fat transfer does well. Taking a face that is actually deflated and giving it a little push-up brow really rejuvenates the mouth in this individual, to include a softness that we can bring back in her lips. And the ethnic facelift, do not be fooled. Even though the term is good black, don't crack, it may bend a little bit. And so for those individuals who want a little bit of a jawline, who want to help with that heavy neck, there are opportunities for us so that we minimize even the likelihood of an incision or a scar. Resurfacing, once again, new paint job. We're talking about even tone and texture. That, along with a facelift that redrapes that tablecloth like we talked about, is an excellent result for this individual. And some of the accessories we can do. Once again, this is a facelift with an eyelid surgery with a little fat transfer in the cheeks, a little bit of wrinkle blocker in the forehead, and then once again, a little bit of fat right here in the corner of the mouth to soften up the lips. A very rejuvenated look for the face, very natural, if you will. And essentially, here is once again a little artist depiction of the Thermi-Tite, where we use injectable radio frequency to shrink the fat, to melt the fat, and actually take out the dimpling that we get not only in the face, but we can use it in other parts of the body, to include the arms and the chest, if you will. So once again, one of my favorite ones, if you as well. And essentially what you're going to see here is the Thermi RF going in. You're going to see it shrinking down. You're going to see it melting the fat, giving back that tight elasticity that we like. And once again, some of these individuals have great skin tightening. Once again, no cutting for you. Here's a young lady that you can see that we had just a little bit of fullness here, want a little bit more of a contoured jawline. Not only did I remove the fat here and tighten up the skin, I put the fat back into the face so it gives her a lot nicer projection for her cheekbone, if you will. And then also this individual complemented her eyelid surgery with some Thermi RF treatment, removing of the fat, placing the fat once again above the brow, around the eyes, nasolabial folds, softening up the lips, really gives her a nice three-quarter look or profile. She is fantastic. She's ready to update her selfie. And once again, sometimes they don't even recognize themselves once they're all made up. So once again, we can get this surgical type result without surgery. A younger individual who's kind of in between, wanted to soften up the chin, if you will. We put a little bit of fat in the face, raised her brow just a little bit. This young lady is in her 70s, did not want surgery, wanted to basically soften up, give her a little bit better profile, and you can see that this is a surgical result using injectable ThermiRF. So to be able to do that with minimal little downtime now is a fantastic tool that we have in the toolbox. And of course, she is thrilled with those results. So we talked about the consultation. We talked a little bit about the procedures. We talked a little bit about post-operative for the Thermi. For those individuals who are doing a traditional facelift, sutures come out in about a week. Most people can fly a computer about 2 or 3 days if they can remote in from home, but most individuals are not going to the market, if you will. And the cost, depending on what you're doing, some of the injectables can start as low as $275 for wrinkle blockers, or even up to a range of $3,500 to $5,000 and up for your non-surgical and your surgical options. So once again, we have different choices for different budgets. And as far as questions are concerned, one of the places where I think that I like to tell a lot of my folks to go is to realself.com. You will see answers, you will see pictures from plastic surgeons from around the country. You can even ask your own questions and get dozens of responses. Please, of course, go to our website at fadeplasticsurgery.com to see some of our before and after pictures, to see some of our testimonials as well. And don't forget our social media. We love to see you there also. And of course, for today's special offer for those who have come to them, the administrator said, hey, we're going to provide those who pay in full $500 off their facelift, their ThermiTite with the fat transfer, and even their laser resurfacing. So I hope you guys had a great time once again at Dr. D TV. We hope to see you soon for a consultation.